Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and I want to welcome our expert guest, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book, No Time to Teach, The Essence of Patient and Family Education for Healthcare Providers. And we'll provide you with some information on how to get a hold of Fran's book as we go throughout the show. Fran, believe it or not, this is episode 50.
That went so fast.
It did, didn't it? When we first started this, I think we both thought we'd probably do 10, and that'd probably about cover everything. But the deeper we dig into it, it's interesting. The more, if you want to learn something, if you want to learn about a topic in detail, start to study and teach it, because that forces you to learn so much more. And I have learned so much in these conversations with you on Skype every week. It is unbelievable, to the point where some people don't like it when they see me come and say, oh no, he's going to talk about patient education again. But it has really been interesting to get these 50 episodes in. And I've gotten some nice email and nice comments from some of the chief nursing officers and patient educators that watch the show, and they appreciate what we're doing. And for you and I, it started out as, well, we'll just kind of see, and then it's kind of become a labor of love. We both enjoy it, I think.
Absolutely.
Yeah. Well, for episode 50, I thought we'd try to do something with a 5 in it. Rather than 50 ideas for patient education, I thought let's just do 5. And so we've come up with a list of 5 ideas that the folks can use to improve patient education and reduce readmissions. And these particular ideas are in no particular order of importance, because they're all important and they all have an impact. But I'll cover each one and then let you talk to us about it, okay?
Sure.
And the first one is one we've talked about a lot, and that is keep your tools, which would be your handouts and your videos, up to date. Why is that important?
That's real important, because you want to make sure that you have things to support what it is you're saying, so that the patient can, for example, in a video, see it better, see the pictures, maybe understand what's going on a little bit better, get reinforced by seeing it in a different way, or seeing people just like him dealing with the same problem.
Yep.
So videos really are helpful for that, and handouts for referring to when they get home, because they're not going to remember all the details. So having the same content that you teach available in paper form that's up to date, so it says the same thing as what you're saying.
Yeah, and they need they need to relate as well, because it's one thing to have the video and the handout, but if they don't agree, that can be a problem, because then it sets some confusion. I've seen that happen before, where the video is later and the handout is a year older than the video, and some information has changed, and as the nurse gives the information, they say, well, ignore this one, we do it this way now. But it's not updated in the handout, and that's not helpful for the patient, is it?
No, because you get confused, and it also, the trust issue.
Yeah.
So you wonder if, do they know what they're doing, because they're telling me 2 different things.
Yeah. I relate that to when I used to fly a lot. When I'd get on the airplane, if I'd happen to pull down the tray and it was dirty, I'm wondering, hopefully they're paying closer attention to the engine maintenance than they are to the cabin cleanliness.
Exactly.
Makes you wonder, doesn't it?
Exactly.
Yeah. Number 2, train your nurses on assessment, teach back, coaching, how to ask questions, and mastering two-way conversations. And all of those topics have been multiple episodes for us, but let's talk about why all that's important.
Your staff, all of them, not just nurses, but especially nurses, because they're always interacting with the patients throughout the day, needs to have the skills to do effective and efficient patient education. And what you talked about are all the skills that they need. And they're really quite simple, but when they are applied, they make huge differences.
Yeah, and one of the things that you always talk about is the conversation. If you can't start the conversation and guide the conversation by using these particular tools, especially assessment and teach back, you're never going to get to the point where you can coach. You know, so
yeah, they all work together. They all work together.
Yeah,
and the coaching is really effective because it helps the patient decide to make changes in behaviors that will improve healthcare over the long term.
Yeah, and as we talked about in a previous episode, the short amount of time that you spend with the doctor is momentary, but to get long-term impact for behavior change and health improvements, the patient and the family caregivers have to focus on that. And if they don't know how to do it, then they can't do it.
And you're not going to get the outcomes.
Yeah. Number 3, this is one of the first things I learned from you, and that is begin education at admission, not discharge. And so often I heard from patient educators that they love our video on demand system because it helps them with all their discharge instructions. And before that I had not thought about that, but you're absolutely right. You need to start this stuff from the get-go, because by the time they're ready to just get discharged, they're not thinking about anything but getting out.
Right. And some things are going to take a little bit more time to teach about, because if the patient comes in not understanding what exactly is wrong, you're going to have to explain all that before you can explain what the self-care skills are to deal with it. Because, I mean, part of the self-care skills are to be able to recognize problems and know how to respond.
Yeah, absolutely. I'll use diabetes as a classic example. If a person has been hospitalized because of complications and they didn't know they were diabetic, it takes the self-care skills that it takes to manage that is not something you're going to teach in a 5-minute discharge, is it?
Not at all. Not at all. That's an ongoing process.
Yeah, no doubt. Okay, item or tip number 4, document interactions and monitor documentation. Now, we've talked about that in the past, and we agree documentation is a pain, so what's the point, right?
And patient education documentation is notoriously the last thing to be done.
Yeah.
Which is interesting because it does have such a big impact on outcomes. You would think people would recognize that communicating with the other people on the healthcare team about the status of education is so important.
Yeah, and in this situation, 2 and 2 doesn't equal 4 for them.
Yeah. So we really have to help healthcare professionals understand that if they can teach from the beginning and document everything that they learn about the patient's understanding of the process and how well they understand the self-care skills, we can continue teaching throughout the hospitalization, and then it's just a summary at discharge. It's no big deal, and it won't hold up the discharge because they will be prepared to go home.
Yeah, and one of the common things that we talked about, and we've done at least one episode on this, and that was the discussions at bed shift change, where there's a handoff. Typically, there's a great handoff on medications and everything that they've done, but there's not a handoff on the education part of it in terms of what the patient understands, what's been covered, and what needs to be covered before discharge, right?
And if you don't have that, every nurse that comes on has to start from the beginning and assess what the patient knows.
Yeah.
So it just makes so much more sense to save time by communicating what you've learned and what goes next.
Yeah. Okay. And the final tip we have today is follow up or provide a confirmed handoff after discharge. And I will tell you from personal experience, the most common discharge instructions we've had is, we'll follow up with your regular doctor in 2 weeks. And then that's the end of it.
Yeah, and if that doctor doesn't get a record of what it was you were taught and what skills you were able to do and what skills you were not yet able to do, that doctor can't follow up effectively and continue the education where they left off.
Yeah, so really important to do that. And I think we've talked about research that supports this being done here recently, and from a scientific standpoint, they're finding out that this follow-up is critical, because in some situations you're not even sure if proper care plans have been made for someone once they leave the hospital. And so someone needs to double check all that stuff to make sure that it's even possible for them to carry out their care plans, because that hadn't been a concern in the past. They're just out the door, you're gone.
Right. Yeah, I mean, there are lots of things that could make it difficult to implement what it was you were taught, and somebody's got to assess that. Yeah,
no doubt. Okay, good tips. I'll repeat those right quick for everybody. Number one, keep your tools up to date. That's especially handouts and videos, and make sure that they relate. Number two, train the entire staff on the important communication skills that are in Fran's book, like assessment, teach back, coaching, how to ask questions, and how to master the two-way conversation, because that's where all the magic is. Number three, begin education on admission, not at discharge. Number four, document everything and make sure that on shift changes that education is included as part of the information that is passed over from one shift to the next. And then the final thing is to make sure there is follow-up and provide a confirmed handoff so everybody knows what they're supposed to do. So those are 5 tips. We could have probably come up with 45 more, but it makes the show too long.
That was a great summary.
Okay, thank you. That's one thing I've gotten really good at as we've done this. So why don't you tell folks where they can find you online to get some more goodies like this from you?
Well, I have a blog at notimetoteach.com, and I'm on Twitter at notimetoteach.
Okay, and your book is available at Amazon and other book retailers and e-tailers, and it's available in both download form like Kindle and paperback, and it's also available for bulk purchase, and there's a sizable discount if folks want to visit your publisher, Pritchett and Hull, and their website is p-h.com, and they can get, I think it's up to 40% discount on bulk purchases that can be used for in-service training and things of that nature. It's a good bargain, and I would encourage folks to go do that. And for those of you that want to update the way you handle video and supplemental education with patients while they're in the hospital, please visit our website, synergybroadcast.com, and look for our patient education system. We call it MMDS, or Medical Media Delivery System. It's a simple, cost-effective solution to providing video on demand in the hospital, which is where you can have the greatest impact on education while the patient's there. So, Fran, thanks so much. It's been fun doing all 50 episodes, and we'll just see how long we can keep this going.
Okay, bye, Chuck.
Bye.